Good evening.
How are you?
I'm good. How are you? Hi, Fran. Hi, Khalid.
Hey Mia, good evening. How are you doing?
Pretty good.
Good.
Did anyone just watch the press conference?
I haven't actually seen anything. I haven't been up to date on today's events as of right now.
Uh, I think the president was to hold a conference at the press conference at the White House to give his latest statement on the election.
If it's not a concession speech, I don't want to hear it.
I'll second that motion.
Listen, he has up until January 19th, 11:59, 2021 to do as his powers are allowed to him. But after that time, if he's not moved out with Melania Trump and the other kids, then he needs to be escorted out. So up until, we'll all have to just sit tight and do what we can, I guess. I don't know.
Right.
I was trying to get my bearings listening to Trump talk.
Almost fall off my chair.
Mm.
Oh
Oh,
my
wow.
gosh.
I could have read you some jokes if that's what you wanted to hear.
This guy can lie. Woo.
Interesting times.
Hello?
Hi, Karima.
Hello, Karima. How are you?
Hi, friend. How are you?
I'm good. It's good to see you on.
Yeah,
I missed you. I haven't seen you in a while.
I know. Sorry about that. Between work and balancing online classes is a little bit challenging, hard. I'm not gonna lie. I felt so bad about missing last month's own. Like, damn, I missed last month's own. All because when I came from work, I was so tired that I took a nap, and by the time I woke up, that the time to sign on for the meeting was already over.
Oh, that's okay. Melissa, I made it.
Yes. What? Anything new?
Hi.
Hi. Yes, I'm Karima. You were saying?
No, I was saying anything new happened since last month I wasn't aware of.
No, we're just discussing as to, what we want to do, where we want to go.
Okay.
Yeah, so you will hear it. Whatever that we've been discussing, you will hear it.
Okay.
Jean, how are you?
Good night, everyone.
You are muted. You are muted.
Hi, how are you, everyone? Actually,
Good.
I'm Enid Dillard from Kingsbrook, One Brooklyn Health, but I'm using my husband's Zoom, Jean-Pierre.
Oh.
That's my
I thought that
alias.
was you.
Hi, Enid.
How are you?
Yeah, I was watching you and I said, well, I know this face, but then I seen a different name.
But
so I
that
said,
name
okay.
is funny. Good to see you.
I didn't want to question it.
It sounds
Hi,
Haitian.
Karen.
Hi,
Mr.
everyone.
Nixon. Good, hi. Hi,
Hello.
Khalid. Hi, Amy. Oh, that's all right. That's all right. Maybe Amy, you needed to stop by us to see.
Trying to connect to environmental. Amy, this is health and social.
I know what it is. I know, but I tried the link that's provided. It says Thursday, November 5th. It says Environmental Protection Committee meeting. And then I was like, oh, wait a second. This is not that, because it was starting to connect the social meeting. So I disconnected and I did it again. So apparently it's the wrong link. So I was just hoping that you could send me the right link. I don't know why.
Yeah, I'm not sure exactly how you got the link for health and social services, but environmental is going to be rescheduled. Fred will be reaching out. He's actually having a conference with the environmental chair, and they will be sending out correspondence to you all on how the committee will be proceeding.
Oh, okay, because, yeah, it hasn't met yet. But I don't know. Maybe I'll just stay for this. Francesca, you have a meeting going. I'll join you.
Thank you, Amy.
Sure.
Okay.
Oh, Fred's
Okay,
not
so
joining us?
Who, Fred?
Uh-huh.
I'm not sure.
I'm not sure. I'm not sure about his schedule. I'm not sure if he's coming in this evening.
Okay.
Yeah, my phone is not working. Can you send a thing to Warren also, please?
Yeah, I just asked Khalid to send it to him. I'm not signed into the CB email right now.
Okay.
Hold on 1 second.
A text message. Maybe he'll get the text message quicker.
Oh, he just sent it via text. Yeah.
Okay. Well, it's now 5 past and I don't want to hold back anyone. So I will say good evening to each and every one of you. It's a pleasure to have you back again after a whole month. It seems like forever. So much have been happening, and I know a whole lot of you lost some sleep, you lost some weight, you added some weight, your stress level has gone up, you need medication. You know, there's so much happening, anxiety level
I wish
off the roof.
I lost weight.
So, so I mean, some people when they're stressed out, they don't eat, and some eat. So some would lose weight, and some will, you know.
Mm.
But in all, we are here, and I'm grateful. Mr. Burke, thank you for coming on. I always like to see your face. I don't like when you're hiding from me. So it's a good thing. So we are here. So welcome again. My name is Francisca Leopold. I'm the chair for the Health and Social Services. And we are here to have a conversation. I'm happy to see Enid back with us today to give us some information. As a matter of fact, I got an email. I think there's a flyer for a town hall that you'll be having. So my colleague from Commission on Human Rights sent it to me today.
Good.
So I should be attending. And I think if you do have that flyer with you tonight, I think you should give it to Mia so Mia could send it out.
Okay.
To
will do.
alert everybody. So in the meantime, now that we are here and I've introduced myself, I will give each person on the platform a chance to introduce themselves. I know a lot of people like to sit behind the camera. I love to see people's faces. I like to make the connection to see the faces.
Mhm.
We don't get to see each other and to hug, and that's the only way I can get to hug you is online. You know, so yeah, so I'll go and so introduce yourselves. I like to have people to introduce themselves to, you know, familiarize yourself, get to know your community, get to know your people.
Mm.
So Mia, go ahead.
Hi, good evening, everyone. I am Mia Hilton, the Assistant District Manager for CB9. I'm glad to see everyone. I believe this is my first time joining Health and Social Services for this meeting session for the fall. I'm glad to be here. I'm interested to see exactly what will be discussed this evening and future plans for the committee. So, hello, everyone.
Hello.
So I'm going to Enid now.
Hi, I'm Enid Dillard. I'm the Director of Marketing and Public Affairs at Kingsbrook at One Brooklyn Health. I'm very glad to be here again with you, Ms. Leopold, and to meet Mia finally. Mia is my comrade and very responsive to me always. So good to meet you and good to be here with everybody.
Welcome, welcome. Thanks for joining us. Karima.
Okay. Hello, everybody. My name is Karima, and I've been on the committee a while, but not that long of a while. I'm currently an MPH student at SUNY Downstate and also currently work for New York Health and Hospitals Test and Trace Corps.
Thank you for coming back. We have somebody on the phone. The last 4 digits, 9998. Can you introduce yourself, please? Unmute yourself, 9998. Identify yourself and introduce yourself, please.
Yeah, I'm sorry. Francis, it's Amy on this. That's my phone number. I did put my my user ID in there, but so I don't know why it's
Okay.
twice.
Okay, so you can introduce yourself, Amy.
Oh, okay. I'm normally not in this group, but I'm a member of Community Board 9. And since I'm here, I'm interested in finding out what your priorities are and what you're working on this year. It'd be interesting to know.
Thank you for being here. Kate?
Hi, my name's Kate. This is my first meeting with Health and Social Services. I'm actually pretty new to the neighborhood and new to the area, but I have my MPH and I currently work as an attorney for the Small Business Administration. So I'm happy to hear what's happening and what everyone has planned.
Welcome, welcome. Thanks for being here with us. I'm Kim.
Good night, everyone. My name is Kim Robinson, and I represent Councilmember Alika Ampry Samuel, representing the 41st District.
Thank you for being with us again. And Karen Chambers.
sorry. Good night, everyone. My name is Karen Chambers, and I am representing the Brooklyn DA's office. This is my first time attending this meeting, and I'm, just happy to be on this call to find out what this event is all about. So, welcome.
Welcome. Nicholas?
Hi, this is Nicholas Almonar, new member of the board. I'm very much interested in the health situation around CB9. I'm happy to be back. I attended the last meeting. I just want to keep following what's going on, and I'm looking forward to work with everyone, especially with you, Mr.
Thank you so much. Thank you. Mr. Burke, our first vice chair. You are muted. You are muted. You are muted, Warren.
Okay. My name is Warren Burke. I'm the first vice chair of Community Board 9, and I'm part of the leadership of the advisory board of Kings County Hospital. I share the board, and Francesca is our second vice chair, and it's a pleasure to speak to everyone tonight.
Thank you. Khalib? Thank you, Mr. Burke. Khalib?
You can call me Warren.
My name is Clayton, Community Assistant for Brooklyn Community Board now. Pretty much everything that Mia said earlier, I'll just second. As the assistant, I'll be on standby to assist you in any endeavors, and I'm hoping, of course, for another successful year for the Health and Social Services Committee. So yeah, it's good to meet you all.
Melissa. Thank you, Khalib.
Hi, everyone. My name is Melissa Severe. So I'm a newer member to Community Board 9, and I'm on this committee, on the Health and Social Services Committee. And in my day-to-day life, I also work for the Department of Health and Mental Hygiene, as you could probably see from my header, which I did not log out of work. Nice to meet everyone.
Hello.
And just to add that we had a young lady with us, our secretary, and she moved to Miami, and Melissa has graciously accepted to be the secretary for the committee. So we thank you so much and looking forward to working with you. And we have Ephraim on the line.
Hello. Yes, I'm trying. Bedtime is stretching longer than I was expecting it to, but I didn't want to miss. So,
okay.
So this is my munchkin, and my name is Ephraim Sherman. I'm a Crown Heights resident, and I'm a nurse practitioner. And I also, this is my second meeting. Very honored to be able to be allowed to participate, and I have lots of thoughts and things I'm happy to be part of. So thanks for having me.
Thank you so much. Thank you for coming back again. Thank you. So I love to take this opportunity because most times we sit and we just see faces and we just had a conversation going, but we don't know who is who, and and we did the connection. So now I'm going to open the platform, the floor, and allow Enid to give us a report on what's happening at Kingsbrook. And welcome again.
Thank you so much for having me. I so appreciate it. As you opened earlier and mentioned that we are having a community information session on November the 16th, and it'll be a virtual as well as a call-in number that we'll provide for that. And basically what we wanted to do is we wanted not only to talk about the transformation of Kingsbrook, which we all know the medical surgical beds will be leaving as of January 1st. And in place of that, we are instituting a medical village, which actually will speak to all of the healthcare needs of our community, especially as it pertains to chronic disease management and care, but also what the One Brooklyn Health interaction really means, which is the coming together of Kingsbrook with Brookdale and Interfaith. I think the community needs to start understanding the bigger picture to that integration. While Kingsbrook's transformation is a very small part of that, there's a very big picture involved in terms of advancing the care of Brooklyn, and it starts with being more collaborative with healthcare. So on the 16th, our CEO, Ms. Lorraine Brown, who has been here before and has shared information about this, will be giving a more extensive overview on the 16th. So we do hope that everyone on this call will be there and that you'll encourage other constituents to join as well, because we do believe it'll be quite informative. There will also be discussions about the housing component that has nothing to do with what is going on in the medical village. It will not, the housing component will not occupy what we're doing on the medical side of the campus, but it is integral to the needs of the community in terms of speaking of the damages of gentrification and how it's really impacted community residents in the research that we've done, in the community needs assessments that we've done over the last 3 years, where the community has actually indicated gentrification as a health issue for them. It impacts them. It is one of the social determinants that we know impact the community in a way where they cannot afford medication and rent, or transportation to their doctor and the rent. And so we felt it best to all of the hospital systems at One Brooklyn Health, Kingsbrook, Interfaith, and Brookdale to figure out a way to be a resolution in that. So many of our campuses will be erecting affordable housing. So the whole conversation of One Brooklyn Health, conceptually what it's supposed to be and how it's supposed to advance the community in health and the social determinants, will be discussed on the 16th. So we do hope that you all will be there to hear all about it and ask the pertinent questions that you need to ask.
So
Yes,
that
I
information will be
encourage, as
given
I
where?
said, somebody just asked a question, go ahead.
Yeah, that's Kim. I'm saying the information for the November 16 event, flyers will be, how
Yes,
would you get
yes.
that information?
I'll make sure to get that to you tonight, Kim.
Okay.
Okay, because I was to send that out to Jennifer, but I'll make sure I put you on the list, okay? Yeah, but everyone here will,
Okay.
I'll make sure you have it.
Okay, so it's K. Robinson.
Yeah, and if you can,
somewhere.
Hey, Robinson, okay, I'll make sure.
Thank you.
You're welcome.
and also if you can put some information, I know you can send the flyer to the board so they can put it on the website.
Yes.
But you can also put some information in the chat also.
I'll put that now.
You know?
Okay. Mhm.
Yeah. So
Thank
at
you.
least, people would have that. Kim, is there anything, Kim, that you would like to share with us? Thank you so much, Enid. Thank you.
You're
Hi,
welcome.
Francesca. It's
Yes.
Warren Burke. I have a question, or not a question, but just a point of fact. And I positively, Kim, if you have people who are uninsured and can't afford their prescriptions as well as medical care, New York City has a program called New York Cares, which will be at any H&H hospital, where they can go down and they can get the treatment that they need, including the transportation, the medical care, and everything else. Thank you.
Sorry, you said what it's at every what hospital?
Health and hospitals.
Oh, okay.
So it's Kings County, it's Coney Island, it's Woodhull, and Brooklyn.
Okay. And the name of the program is New York Cares?
New York Care, NYC Cares, actually.
Got it.
And we've had great enrollment in that. So, but there is no reason why anyone is not getting their treatment at this point in time.
All right.
Thank you.
Thanks.
Okay.
Thank you.
So Kim, since you're on there, is there anything that you would like to share with us from your office?
Not at the moment. Just wishing everyone to be safe, and we're just waiting.
Okay. Okay, thank you. So our conversation last month, we spoke about sickle cell, and we are looking to have to keep the conversation going, because usually, as I said before, we have 1 month, and that month for celebration, and diabetes is there, sickle cell is there, and all the other ailments there. And I know there's just 1 month and everybody makes a big deal out of it and then it just died down. So we'll continue our conversation. So I'm looking like every quarter, based on how our agenda is for the month, that we can have a slot in our community meetings to have a wellness section, so where we could speak on different areas of health. So last month we had sickle cell, but we haven't done it. That it will be coming up. And also for this month is Diabetes Month. And I'm hoping that we can do something and have some sort of send out something, send out a blog. And I think our community, we are really taking diabetes and all those different maladies too lightly until it really hits you and somebody is really down with it. And people have to get to a place where they know their risk, their eating habits, how their eating habits are, how they include, when it comes to diabetes, how they include fitness into the daily routine, and also managing the stress. And it has a lot. And I'm telling you, I think that people's stress level from March and this election didn't do it any justice. People's stress level has gone off the roof, you know, and then we should be, and we have, you have, I think it's Workwell New York, Workwell NYC, and anybody can go on Workwell NYC, and then there's a vast amount of information that you can get on wellness, and even if you need somebody to talk to when it comes, because one thing I realize with us Black people, and it doesn't only pertain to, it's both men and women, and we feel that if we sit down with any clinical person and talk, we are afraid for them to say that we are crazy. You are not crazy. You are looking for wellness for yourself. You are just looking for this space where you can sit down and you can just talk and just breathe and just let somebody hear you. Sometimes we don't necessarily need somebody to answer back. We just need somebody to listen. We just need to talk, you know? And then a lot of us, we have sitting with a clinical person, and we have that stigma that, oh, they think I'm crazy, or they think I'm a quack. No, it helps. It's very helpful, you know, and then it helps your sugar level. It helps your hypertension level. It does so much when you distress, because stress takes over your body and it causes so much different things to happen in your body. So it is very important. So New York City has the New York City EAP, where you can go, you can call, you know, and if you go on NYC Help, all this information is there. So the amount of stress that we are going through, and it doesn't look like it's getting any better. We need to concentrate on us and ourselves and the space we're in, and take care of ourselves. You know, so outside is not too hot. Let's go walking. Put a group together. Get up early in the morning. Go for a walk. If you don't want to walk in the morning, walk in the afternoon. But let's get ourselves going, and the foods that we eat, let's change our eating habits, but let's try and have that frame of mind, you know, to get ourselves, because I'm telling you, it's not easy. Sitting here during the day, I'm working, but I'm not working because my mind is just going crazy. I was already trying to pack up, ready to pack up to go home. I said, based on the results of the election, I was like ready to go home, you know. But hey, but we are here. So one thing that I'm looking for, we have been talking a lot, and Ephraim contributed the last meeting with COVID in our community, and we do need, and I just need, I don't know if Enid and Kim and Karen, you know, whoever, you know, have any, it could be 4 packs, 4 boxes, 5 boxes. I'll take them. When it comes to masks and hand sanitizers, we need those things to give out in our community. Our community is in dire need of PPEs. Some people not necessarily want the shield. I know, Mia, how many boxes were there shields that Presbyterian Hospital sent to us at the board?
I believe it's a box of 100 shields, face shields.
100 shields, yeah. You know, so there are people who might use the face shields, but we do need we need the mask. I walk on the streets and I see people, and then you can tell that the mask is dirty because of the constant touching, because that's the only mask they have. So, and some people, they're using a mask for a whole week. It's just not safe and it's not healthy, you know. And also we need they need hand sanitizers. So my undertaking for, I'm just gonna stop, because Enid, you just unmuted your phone, so I know that you wanted to say something. So I'll pause and give you the floor.
Yes. So how many would you need? And if we were able to get them to you, where would we be dropping them off?
At the board's office at 19 Nostrand Avenue.
Mhm. And how many would you really?
And as you said, as many as we can. The last time that we were given 10, I think it was 10,000 masks that we give out, and it was not enough. It was just the drop in the bucket.
Okay. Okay. I'll get back to you.
Yes. So as many masks that we can get and hand sanitizers, the small bottles, because what we are looking to do for Thanksgiving, and then I'm gonna throw that out there again. And also Matthew Eugene, he is on board to work with us to get some masks for us as well. But every Friday he give out food and masks. So I don't know as to how many in the supply, how much he can give us, right? And but for Thanksgiving, because of COVID, we cannot do cooked food to give out for Thanksgiving because we have so many people in our community who are out of work. And I mean, somebody might say, well, you know what? They get food every day, but the food that they are getting, it does not last them for a week. When they go to the places where they are giving out the food, it's just food for 2 days.
Right.
You know, and if they have a big family, it does not last for 2 days. So the food is needed. So because of COVID, I was thinking of, try to get a dinner for Thanksgiving, but then because of COVID, we cannot do that. So I'm looking at the week before Thanksgiving, which will be Mia and I, we have been talking about that. So I'm looking like the 19th or the 20th rather, if we can have, get dry goods. So we are trying to see how many organizations who can, I've been talking to Karen from the DA's office also, and there are some more people. So if you know of any organization that we can get food, dry goods to give out, so that's very same day, we would like to give out the food and give out the mask and everything, on the 19th of this month, on the 20th of this month. That will be the day of the giveaway. So we'd like to give out food, to the people in the community. If it's one thing, and I mean, anybody who needs to elaborate and think that it's not necessary to think that way, I will apologize. But I find that even if my church, we give out food, dry goods one day of the week, and the next day we give out cooked meals. But I find that there are people in the community, they don't get the food that is given. The people from all over come and get the food, and you don't know who is who. You understand? And that is because sometimes you find somebody will come and they'll tell you, oh, I'm just coming from work, I'm just rushing to come. So how do you, and maybe Mia and Warren, can chime in and say something, and Edith, whoever wants to comment, make a comment on that. It's a concern that I have, because we want to help everybody, but that particular week, I want to help the community in the surroundings, the people right there. And then you'll find there are people who just drive all over just to get food. And some of them, they don't necessarily need it. Some of those people, they go around and get those things to pack a barrel to send home. And then we have people right there who are in need. They're in dire need of the items. So how do you tell someone who's not from the community? How do we do that when we are giving out the items? Because I really want my people in the community to get what we are giving. Because I walk the streets, I walk down Nostrand, I walk in Empire, I walk on Utica. They're in dire need of the supplies that we're going to give out. So anyone who wants to say anything about that?
I think that some of the electeds and some of our community partners have done targeted drops to specific developments where they know there's a large senior population, so that they know those goods get to those people on site. But the thing I know that we had an issue with when we were giving away the census info and the masks at the office, we pretty much service whoever is passing our office. And when it comes to food, it's almost an embarrassment to kind of turn people away when it's sitting right there. So although our target audience, a target demographic is for our constituents in CB9. I think that we have to remain open to whoever, comes to us and say that they are in need, whether it's true or not, that, that's on them. But I think that it will be hard to turn people away, and that we shouldn't. Unless we're going to plan to do targeted distribution at specific areas and in specific buildings.
I totally agree with you, Mia, because we have the same problem at our office. People, for me personally, when I'm in the office and we have food, someone walks up, I don't ask which, where they live specifically. If they're asking for food and there's food there, there's box, I give it out. Yes, sometimes it's a challenge because then you have someone who I know lives in the district who would come in at that like 10, 15 minutes later and says, do you have any bags or any food? And I did, and I gave it away. So sometimes it is challenging, and it's hard. It's a hard call. It really is a hard call.
Yeah. Warren?
Hi, this is Warren. Number one, I agree with anybody who comes should get it. I also agree with what Mia said about targeted food drops. And I also want to bring up that there's a number of mental health programs that I know of that are doing Thanksgiving dinner takeaway, where they're preparing all the food and for their clients and everything else, and they're giving them, go home bags. So that's something that our organizations could consider, if they're capable of doing it.
Okay, thank you much.
Francesca, this is me. Am I unmuted? Oh, okay. I'm new to this, but I live by 2 food drops that I see regularly, during the week. And, people stand online, they seem like they're locals and such, but I mean, could you maybe frame it like in your signage or something saying community food giveaway between 5 and 6, all other comers after 6 or something like that? Or, just kind of give the front of the line to locals. And of course, if somebody wants to wait and they're not in the area, they can certainly, be there if there's anything left over.
I have a question.
Mm-hmm.
I have a question.
Yeah, go ahead.
So,
go ahead.
Do you ask for ID when you give food away?
Do we what?
Do you ask for ID?
No.
So how would you know if someone is actually a resident who's not a resident?
Because sometimes they say, well, I'm from Manhattan, I'm from this place. They would say where they're coming from. Yeah.
Oh, okay.
Because even with Diana, when Diana's doing her food thing, she do the registration. People give their name, telephone numbers, and thank you, the sign-in sheets. And sometimes you have people from Queens, you have people from Manhattan. I think one time we had I think Mia, we had somebody when we were doing it at the border, there was somebody who walked past from Staten Island.
Yeah.
Yes.
I had someone from
But I think Diana's food giveaway is a really great example because there will be people in line from 8 a.m. for an 11 a.m. distribution. So if you're willing to stand up for those amount of and seniors at that, I think that location can be a determining factor in service.
Yeah, go ahead.
I experienced something about, I want to say maybe about 3 months ago, and I think it was just by accident. So we were doing a giveaway. The church across the street was doing a food giveaway at the same time. So we saw this older, I would say seniors, it was 3 of them, and the shopping bag. And there was another giveaway, I think it was at Zelnor. They might have done that a bit earlier. And one of his staff came over to assist us. And he said, wait a minute, they were just over by our side. So I also think there are people who just, I don't know, they go shopping, like they just from place to place to place. I don't know if those people are people that's in need or those are people that just need to be doing or just just to get out, and they go and they just pick up, and it just becomes like over the last couple of months, just become a habit. And for them, it's something that may just to keep them alive. Right. So I'm not sure if, people just go and take just because it's there or because they really need it.
So,
So
Kim,
that's always a
and
concern.
that's the reason why I make that comment, right? I threw that on the
Yeah.
floor because at my church is on Church on 56. So on Thursdays we give dry goods, one bag of dry goods, one bag wet. So the wet could be fish, it could be chicken, cheese, whatever. And then we have all rice and whatever in the other bag. And people, we give chicken breast, and people would come in, they will take the bags, they will go outside on the sidewalk, they will pick out what they want from the bag, and they will throw the rest on the side of the street. So then you would find people now, and it's like, what? You got to be kidding me.
Yeah.
And so then people from the neighborhood who really needs it, when they're walking down the street, they would pick them up. And I remember one Thursday, I had to get back home to work. So I left the church early. And once I was driving back, I drove up 51st Street. So, when you get to 51st Street on Rockland, that's a dead end. So you could either go left or right. And there's a church right there, if you look right. And there was very some people who were at my church, they were at that church there picking up stuff. And mind you, the very same items that they were given at that location, they were giving them at our location. They got the very same item. And that's why I was saying, and I understand with everybody, when they come, you give, but as it was told, it was mentioned to me that a lot of people, because people do say things and then they talk. And they said like a lot of those people, all those dry goods and stuff, they take it and pack a barrel, so that they could send it home. And I had this, some ladies, they were there, and I said to them, they were afraid to pick up this stuff. I said, ma'am, look, you came and then we gave you stuff. If those people don't want this stuff and you think that you can use it, you have use for it, take them. If you have your neighbors or you have your family that you want to give them to, take them, say, we can. And we said, yes, go ahead and take them. They were afraid to take them, and they took them. So there are people genuinely, they don't need this stuff, but they come and get it. The people who really need them, and that's my concern. And I am all for giving food. I'm all for that because I know that people in our community, so many people in our community, they were suffering before COVID, and COVID has done it,
amplified it.
Right, injustice to our community when they don't have a job, and it's hard, and people have children, so that's my concern. Because I tell you, I'm watching men, they're walking down the street, and then they have even like I work the polls on Tuesday, and I'm seeing people in the district who come in to vote, and then when they come to the desk, and you could see the dirt and everything and the mask, and you can tell that the mask was being used. And I know there are people, I don't know if Warren gave the 71st%, was with us with Little Essential. And then we were giving out those masks, and we gave masks from Nordstrom to Utica, and there are people, they were so happy because it was like, I've been wearing this mask for a whole week, so we know because people, and a lot of people, they're selling masks and the masks are not good. They go and they would buy the mask for $5, and by the time they put it, so the one sleeve would fall off because they're infuriated. So that's why I am fine to give food to anybody. It's just that I'm just talking about that time of year. I just want to target the people in my community. And then I just want the people in my community to be fed and to get something. And, and I don't want another thing. If there's an organization who's going to send food to us in the community and send us rotten food, I don't want it. Keep it.
Yeah.
I don't want it.
Yeah.
Because when you go to other different areas of Brooklyn, the food, the quality of food that they get,
fresh.
And then fresh and nice. And when I look and the stuff that come to our community, they sent us boxes and boxes of blueberries, and they had mold. All of them was molded. So they send you
Leftovers,
apples and
yeah.
all the stuff, and they are rotten and it's mold. And if you're going to send us something in our community to feed our people, I want them to be stuff that is of quality and that is fresh. You know, so
I think that the 19th is a good day for us to, I guess we would be using the board office, and so we don't have a lot of options in terms of distribution points. But we would definitely need maybe a member, 2 or 3 of the committee to perhaps meet at the board office to sort and compile whatever donations do obtain so that it can truly be grab and go that day.
Yeah. And that's exactly what we'll be doing. So, I mean, we need all the help we can, because especially when with the dry stuff, like the Thursday, we can, you know, bag the dry stuff. And if they send us any, because usually if they're giving you any wet stuff like fish or chicken or whatever it is, then they would bring it the day of. So the day of, we'll just concentrate on the wet stuff that they bring. And then we will have a table right in front of the door. So no one will be coming into the board office, and it will just be given out. So we'll give out a bag with the PPAs and a bag with, and 2 bags with the food, whatever we can give. But whatever information each and every one of you can get for us, when it comes to food stuff, the PPAs, we will be happy to get it. And we don't have a lot of time.
No, I think we need to nail this down within the next few days in terms of what exactly we're expecting from whom, and schedule, figure out who's going to be able to come on site and assist at the board office to compile it.
But what time?
For that day frame, what time are you? Well, assuming in preparation for the event the day before, of course, Khalid and I would come to the office and make it available to whoever's able to volunteer.
Yeah. So whoever, I mean, everyone's working, because for me, I have to look at my schedule. If my schedule is free, I can take the Thursday off, and the Friday off, I can take the Friday off and go to the board. And then the Thursday afternoon, you know, I can go to the board and start packing. So whoever can give out something, an hour, 2 or 3 hours to start packing the bags, the dry goods, the Thursday, that's good. And then whatever that we can do for the Friday, then we'll have the dry goods and also the mask and stuff. So we put them in the bags. If we're giving out 3 bags, 3 masks, or how many masks, based on how many we have, that's the distribution we'll give. So we'll already have the Ziploc bags. So we will ask for a donation of Ziploc bags, donation of the small Ziploc bags, donation of, not very small though, that could hold at least 4 masks or 3 masks, and the hand sanitizers. Yeah. So that, hand sanitizers. So we get some donation of the bags, that will be great. And then the food stuff. So I have to show it. I know that, what's his name again? Nicholas, I know that Nicholas is very interested in working with us. So I'm trusting that he will be there, and whoever else. I'm looking for Kate. Is Kate still there?
Hey, Fran.
Kate? Yes.
Can I say something? Yeah, sure. No. I think it was you that said earlier that people would take certain stuff out of the bag and throw it away, whatever they didn't like. Is there a way to set up the food distribution so that people can actually choose what they want, or all of the bags they must be pre-made when people come to get them? I know like it would require more staffing, but is there a way to do it?
It has
so
to be
people can choose what they get?
I think that there are places who does that, but they have the space, you know. And this summer there was a church on Church Avenue. They did that. They had all the food lined out, and people came and said, "Okay, let me have this, let me have that, and let me have that." But we don't have the space, and it's cold, you know. So people and we don't have that area because we cannot utilize the whole sidewalk to do that because there are other businesses. So we can do that. So we don't have a choice but to bag. So very few places do that. It's the best thing because the food will not go to waste. But for us, we already don't have any option but to bag, you know, to give them what we have. Nicholas, is there anything you want to say?
Yeah, I have a couple of things I want to say. One, I'll be available to help out. So just tell me when and what time. My time is pretty open these days. And two, a suggestion, across the street from the office where we sometimes have a meeting in that housing complex there, is there any way we could use that area for food distribution?
No.
Yeah,
No,
they
that's
said
why.
they're closed indefinitely
Ah, okay,
to use it for outside of their own board usage.
okay. All right, that was my suggestion.
I
Unless we could
know,
find,
that'd have been perfect.
yeah, unless we could find a church
Mm.
that's close by that would allow us to use their premises. If it's not to
Yeah.
call even right outside in their parking lot.
Yeah, I know. I don't know. Mia, is the school Mega Evers, do they have a parking lot or a yard or something?
No,
No, they
no.
don't have.
They don't have a lot. The nearest lot that they have is for, I believe, student and employee parking, and that's Bedford.
That's all the way on
Brown,
Bedford
no,
and
Montgomery.
Franklin. Yeah,
Yeah.
that's very far. Mhm.
Oh, that's one. Okay. Ephraim, are you there or are you still putting the baby to sleep?
Oh, I'm here. I'm here.
Okay, so is there any way that anything that you want to share with us, and is any way that you can get us some PPEs? Because I know you work in the hospital.
Right. No, so PPEs are fairly tight for everybody. I think and this, I don't know if the word has gone up, but gloves. There's actually going to be shortly a national glove shortage.
Really?
They're talking about even like starting to bring in like latex gloves, which you normally would never do because they're people with latex allergies. People are I think bracing for a rough winter and hoarding.
Right.
The hospitals are kind of hoarding. So I definitely,
Right.
if I see any, I will pass it along. I have not seen. That's challenging. That's challenging.
Yeah.
I saw one potential lead on some N95 masks, but those probably would have to be paid for. And I don't even know if they're still available. Somebody sent one to a WhatsApp group. But if I find any good leads, I promise I'll pass them on.
Okay. I thank you much.
For sure.
Yeah. Anything else you want to share with us?
So I think, in terms of just I think Crown Heights thankfully sort of like got through the like late September, early mid-October sort of crush of visitors from around the world with only minimal COVID spread. Like there was still maybe like 5 or 6 positive cases per day in each of the local primary care offices, at least some of them. But thankfully it has not exploded like it could have. It may still, but it has not yet, thank God, at least in our immediate area. Let's hope that continues. I guess we'll see.
Definitely.
It's really, I don't know if you're noticing. I'm noticing people are increasing numbers of people wearing masks on the street. Still not as much as it should be, not even close, but it is more than it was at our last meeting. So baby steps. I don't know. We'll see. We will see.
Yeah, definitely. Thank you. Yeah. So Amy, I'm not going past your suggestion. I'm thinking because I know that I don't know how we can face that, how we can work around that, but we'll see what we can do. We'll come up with a solution.
I was going to ask you, is Associate maybe associated would let you use their parking lot? I know that they're open to a lot of the community board things. They have space. It would be outside. Yeah.
I was thinking about them, but they're always full, and they have cars that use part of the parking, so they are always, full.
It used to be a lot of that car place used the back end of it. I'm not certain if I don't walk through there often, but I don't know if they're still there because okay. And then maybe over by the Clove Road kind of area, maybe people could come and go down Cove Road. Maybe it's a drive up thing.
They're still,
I
they're still there.
too, with the other lady had mentioned, I mean, again, it's distressing because I live kind of between two food drops, and I do see that a lot. And I just think it's just horrible. People get boxes of food, they go to the corner, they pick through it, and everything they don't want just gets discarded. And they just throw it on top of a garbage heap. They just put it on top of the municipal can. I swear, like packages of rice or grits or something you have to prepare. And, you know, it just seems there are people who want it. And then are people who are just, you know, in a way, you know, maybe the pre-package, if you get packages of rice or fruit or something like that, the dry goods, maybe you just have just a quick assembly, like maybe some stuff goes in the bag, but you say like, maybe you just have like a list of items that you do have that you're giving away, and it's on the table, and you say, is there anything you don't like or you would prefer not to have, you know, or just something like that. So, you know, maybe they say, no, I like everything, or you know what, I never eat this, or I can't prepare this. You'd be like, fine. Because even just down the street from me, somebody threw out all the vegetables, like the cucumbers and something like that was in the food box that was given out this morning at the Caribbean place on Rogers. And I was just like, oh my gosh, that's like, I just don't understand it. But if you could try to prevent something like that, it would probably be better.
Yeah, I mean, with the weather, if the weather was better, because earlier, I think, was it 2 months ago, Mia and I, we were giving out the stuff for the census, and we had little giveaways that we were giving, and we had the tent outside and 3 tables, and that would have been ideal because we could put the boxes of foods that we have, and then, you know, people can, you know, choose what they want, and then we just put them in the bags for them, and they can, you know, take it with them, and that would have been ideal thing. So we know that the food don't go to waste. You know, but with the weather changing, and we don't know what tomorrow, we don't know what the next 2 weeks will be like, you know, when it comes to the weather. So that is something. Yeah. So I move away from this. As I said, that anyone who knows any information that we can get, you can just contact me, contact the board office, and Caleb or Mia will gather the information, and then we'll move on from there, and then we'll take it. And anyone who would like to donate their time, the Friday and the 19th and the 20th, so let Mia know, so she will take the names of the volunteers and what time you're coming. If you want to come for the whole day, it's fine, you know. And then we take, and we accept food for us to eat. I accept curry goat and white rice. That would be lunch. I know Enid looked like somebody. She was the first person who left. I know Enid looked like somebody who would cook a mean curry goat, you know. I know that, Enid. I can see that. Yes, Warren.
Are the elected officials giving away turkeys this year?
Go ahead, Mia.
I believe Assemblywoman Richardson is. I think she will be doing so earlier in the week. I believe that Tuesday before.
Okay, and probably Lori Cumbo and the usual, because that's very important.
Yeah, but I think they have to find, I think in Assemblywoman Richardson's case, she's using a schoolyard. In past practices, they've been able to use school buildings, and that's not an option at this point. So they're gonna have to locate open spaces where they can do these distributions.
I thought they had to use our office.
She's not gonna be able to do that.
Okay.
She's gonna be in the schoolyard, I believe in St. Francis of Assisi on Lincoln Road.
Okay.
Just so that she can, you know, people can take it and go, and they be in an open air space.
Okay, so we just need to remember that and get the word out.
Yeah, I don't believe they've created the flyer yet, and I haven't heard anything from Arna at Lori's office as of yet.
Yeah, okay. I'm sure it's happening.
Also, yeah, definitely. Kim, do you have any?
My point to saying this is not to forget it. That's all.
Yeah. And before Karen, I know Karen muted herself, she has something to say. And just before Karen, just to remember that the days and time that you come into the board, we need to know because we cannot have too many people in the board office. So the back room, we could have at least 2 persons there working and 2 persons in the front. We can have, 5, 6 persons, or 10 persons in there. So please work it out with Mia, and then you could work by turns, maybe afternoon. So how many people go in the afternoon? I know Amy says she leave work at 5, so she can come in the afternoon, so that we can work with. So we don't have too many people in the board office at one time, at any given time. Thank you. Karen, go ahead.
Yeah, I know my office is working on turkeys also. So I'll finally see how many turkeys that we do get so we can give out. And we're also working with restaurants that who want to prepare meals, we will give them food to cook for the community. I'm working with one restaurant on Nostrand, and it's a collective of restaurants there, restaurants and bars that they are also helping my office do some cooked foods for Thanksgiving.
Okay. Okay, cool. That's wonderful. So let us know on anything that we can get from your office. We'll be happy to get. And also if we can get in touch with, is it Health First to get some bags to put the food in?
Oh, that's great.
So
That's
that
no
would-
problem. I can do that. How many bags you want? Like 500?
That will work.
Sounds good,
Okay.
Karen.
All right, so I'll
Yeah.
reach out.
Okay. Thank you very, very, very much. Also for next month, we will have somebody, a presenter from, I think from Cornell University, I think, or the hospital. They would be talking, do a presentation on the ergonomic awareness for children doing virtual learning at home. And also for people who are working at home, because as we look and we know, and those of us who have children in our homes, we can see how they sit at their computer doing their work, during the day when they're doing the virtual learning. So we will have somebody who will come and address, so we'll be sending out a flyer. After the day, we'll have the presentation. So parents could come, invite your friends and whoever. And so they will come and then they will listen, they will ask questions, because at the end of this pandemic, we don't want our kids going out there slouching and, having back problems, neck problems, and even me, I'm my back hurts, although I have the back brace and I have the seat in the cushion in the seat, I'm still suffering with neck pain. My neck is always hurting me, so we would just get some information as to the best thing that we can do, how many times we should get up, to take that stretch, lie down, and put up our feet, let the blood start flowing back into our brains and stuff. So we'll have that presentation. So what happened is that because I was looking to have the presentation done during our board meeting, the general board meeting, but they would only have a 5 to 10 minute slot. And the presentation is almost 45 minutes. So for next month, for December, which is December 3rd, we will have a short discussion, and the rest of somebody's phone, I'm getting feedback. So we'll have a short discussion for December 3rd, because our meeting is the first Thursday of every month. And then we'll have the presentation on the ergonomic awareness for the, if you have your kids, you're home. So those of you who have kids, let your kids sit down, let them listen to it, so they'll know, what to do, how to sit at the laptops, at the computer, wherever. And you'll know the best chairs to get for them, so take care of their health and their body structure while they're still young. Kate, is there anything, would you like to share anything with us, Kate?
Yes, this is Warren. I'd like to give an update of what's going on in the health in our area. Can you hear me?
Yes, we can.
Okay. I had a number of subcommittee meetings today at King County Hospital. The first thing to report about is COVID. There has been a number of COVID cases, but nothing out of the ordinary. We asked the administration about emergency plans, and there's the one negative, and let me speak about that first, is that during our last COVID crisis, we had a number of volunteers from across the country come and help us out. But because of their own COVID situations, we don't think that will be available. So at least in Kings County, they're preparing for this. All the staff is being cross-trained to do X, Y, and Z if there is a COVID breakout. The other thing is they have divided the hospital, and this is all planning, it's not happening now, into hot zones and cold zones. So the hot zones for COVID will be in a certain building that has a lot of floors, and they'll be able to expand. So that's number one. Number two, on the mental health front, we had a huge surge going back 2 months, probably about 300% in terms of people who needed mental health advice. And that has subsided. Essentially, the people from behavioral health have gone to the Department of Mental Health and said that, hey, a lot of organizations that not have been, admitting before are not admitting. So they've been speaking with the Department of Mental Health, and more places are being open. At this point, the 300% surge has subsided, as well as there was another issue about forensic mental health, where there was a huge amount, but it's being dealt with. And from the information that I got today, it's been subsided. So in terms of COVID, the feeling of the hospital is that number one, obviously everybody should take their precautions. Number two, because of Kings County learning curve, people are not coming in as sick as they are. And where there was a shortage and a big question about ventilators, there's a lot of people not reaching that point. So what King's asked is that everybody be very, very instrumental about wearing PPE, and hopefully we will not repeat what occurred in the past. Thank you.
Thank you so much, Warren. And as I said, I'm sorry I was not able to be part of the meeting today, because just before I came on this meeting, I had a training. I was doing a workshop for my job, so I was not able to attend. But thank you for the update. Kate, are you available? Would you like to share anything with us?
I'm here. I don't have anything to share, but it was great being here for my first meeting and seeing how it all works. So thank you so much.
Okay, you're welcome. Very welcome. So my main thing, because we're approaching. Yes,
Hi,
somebody said. Yeah, go ahead, Amy.
Oh, okay, sorry. Just two quick ideas, and you can take them or leave them. My mom's on the other end of the scale. She belongs to a senior group, and since COVID, they've been doing everything online. But it's really something that they have. People, they bring in a physical therapist, and they go on camera and they do the 10-minute or 15-minute chair stretching. Just really simple things, but when you have people in their 80s and 90s, it's something. But now today I'm all over YouTube virtually every day, and there's so much stuff out there. So it just seems like it would be a great opportunity if you had somebody from the Cornell that was talking about posture or stretchers or something like that. That if there were like a YouTube link to something that's about a 10-minute or 15-minute, maybe it's a, with happening music, something that it's engaging for kids, that they could do every day. They could just tune into it. A link, you just send it, and boom, this is what you do, 10 minutes or twice a day or something like that when you're sitting at your computer. And it could do something.
Wonderful.
That's
great
all.
idea. Wonderful. That's a great idea. And we're taking it all in, and we're making note of it. Enid, is there anything based on your background and stuff, anything that you would like to share with all the discussion that's going on?
Well, I know that, Kingsbrook has a really great rehabilitation center. And I'm thinking we've done spasticity screenings in the past, pain management. I'm just wondering if there's nothing we can be doing here to be educating persons at this meeting and beyond, getting some type of virtual scope together about pain management, how to stretch, how to keep your body healthy. So I'm going to take it back to our team to see what we might be able to create just for Community Board 9 and our community, our immediate, community members.
Yeah. That would be great. That would be, because it's all about, and I'm happy that Amy spoke about the seniors, because this is one of my pet peeves, the seniors, and I'm very much concerned of what's happening with the seniors. They are at home, and some of them, used to leave home and go to this this recreational center, meet their friends and talk, play a game or something, and now they are all home, and even those who live like St. Christopher's, the center is attached to the NYCHA building, so they would live upstairs and they go to the center, they play the games and they do everything, and then they go back upstairs, and now they can't even do that. So if they can find something, because, and on top of it all, they are not even able to go outside, because some of them, they don't want to go outside at all, so just home. So if there is something that we can do for them, because getting in touch with them, we can connect with the directors of the senior centers, because they have the portal with all their numbers and everything in there. And then they can communicate with them. And some of them who have young people at home, they could turn on the Zoom and set up the Zoom for them. Some of them have, I don't know if all of them still have the aides that go there with them, but the aides could set up with them and help them, let them, stretch, do something, and if anything, we can even play a game with them online, do something with them online, just get their minds going, because some of them, they're just sitting home, they're just watching TV every day, or they're lying down in the bed, we don't know what they're doing, but just to get their minds going again, even though they can't see people, because most times they're just in their families, and some of them have no family, they're just in their aid in the house. So just to do something, just to show, hey, there's a community out there who cares about you, who is thinking about you, and then, and reach out to them, because the space we are in now, and the space that we have for us, it shouldn't be a space that is my space anymore. It should be a space where it is our space, where we are there for each other, no matter race, color, creed, gender, it doesn't matter. It's across the board that we should be there for each and every person, and create that space for each person and reach out to each person. And presently, the only way we can really reach out to people is via Zoom, is via this platform right now. So whatever that is presented to us, we have to make it work. We have to make it do and go with it. So I think we can have and even for for us, we can have a night of scavenger hunt. Have some fun. Do something. I mean, Kim, we had our scavenger hunt for one Crown Height, and it was great. And I do scavenger hunt for my church, for everybody, and then we have fun. And I think next week I'll be doing scavenger hunt for Commission on Human Rights for my job, during the day. So hey, so we do something, because even us, we're stressed out outside because we think of everybody else, but then what's about us? You know, we have to take care of ourselves first. We think about the community and stuff. We think about our family, about our jobs and everything, but we have to take time and then to sit down and to thaw out, because we are frozen. And sometimes when we go to bed, we are just so tense up, we can't even sleep. You know, and you sleep for a few hours and you jump up in the night and you can't sleep again because there's just so much that's just playing on you. But then that's a great, so any ideas that you have, even coming to the community, because I mean, here we have Presbyterian Hospital who came into joining with us. We have Kings County that we are working with, and working with Kingsbrook. It's good collaboration. We could come together. And as I said, I just want to have a wellness segment of our meetings on the board. So if we have any items that we want to do present, and it will take more than 15 minutes, then my space for my meeting space every month, I would use that space, you know, so the people could have time to, they don't have to rush it. So I will use that space instead, you know, so we could invite people and let them come and people could ask the questions, or if it's a game, or if it's some stretches or whatever, you know, then we can do it. When it comes to the seniors, it's kind of ticklish because our meetings are in the evening, and sometimes in the evening times at the time seniors want to be in bed. You know, when 6 o'clock, 7 o'clock, they're already, so we have to think of a space where we could have a day, and we said, okay, we will do something for them by around 2, 3 o'clock in the afternoon. So they are up, you know, and then they do the exercising or whatever that they do, and they're a little tired and they go lay down when they have a peaceful night rest. You know, so we have to look at, you know, balance it out to have a space for them for that time, but at an earlier time. And it's not just my decision, it is us community working together. And if we work together and we collaborate and we put our minds together and put our ideas together, we will make it work. We'll have things happening, and whatever that we're aiming to do for our community, it will be tremendously good. So it's now 8:12. I don't want to keep you guys too much longer. Is there anyone who wants to share anything with us? Anybody wants to say? The Melissa, who is my second hand right now, anything you want to say, Melissa? Anybody wants to share anything before we close?
Hi, Fran. No, I'm good. Thank you so much, though.
You're so welcome. So Karen, I'm looking to, if you want, it's still early, Karen, if you want to call me after the meeting, it's fine. You can call me on WhatsApp, we can talk. And I'm so happy to see so many of you, and I'm looking at my participants. So nobody fell asleep, everybody been there, everybody participated. And I'm so happy. Please, whatever information you have based on what we spoke about for the 20th, please contact the board office, be it PPEs, be it an organization where we can get food from. Let Mia or Caleb know, any one of them will take the information. If you so want to donate some of your time to put the bags together, let Mia know so that she will have a schedule as to the time that we'll be meeting at the board to make it happen. I appreciate your time, I appreciate you, and I'm looking forward for us to, you know, keep working together. Even Enid, when everything starts working with the hospital, I would still want to see your presence, you know, on this platform with us.
You're stuck with me.
Oh, I hope so. I hope so. And you could bring somebody together, because as a community partner, you're welcome on board. Your whatever guidance you want to give, anything that you want to bring to the table, anything that will enhance the quality of life in our community, I'm all open to it.
Thank you so much. Thank you.
So you could come in, you could come anytime, you could invite whoever that you want to invite, and let's make it happen.
Absolutely.
Yeah, let's make it happen. Nicholas, is there, before we go, anything you want to say? You're muted. You're muted.
Now, I will be there for the 20th to come and help out if I think of anything else. The only thing I was thinking about, since we're looking for open spaces, in my block, I have a park. There's a basketball park on BIPS 92. Is that something that can be used if you want to think about doing an outdoor distribution on my block?
Yeah, but the only thing I always concern about, because a lot of the people who usually come to pick up from us, they are they work with wheelchairs, they have the cane, not all of them. So I always look for a space where easy access and transportation. So where you have the train is right there, the bus is right there, and you're able to get their stuff, wait for the train or get on the bus, that they don't have to travel too far. That's always my concern.
That area is a block away from the Winthrop Avenue train station. It's all one level. There's no stairs. There's nothing in there. It's something to consider and go to look into.
Okay. I got you. Thank you so much. Yes, and thank you everyone for your contribution. It was a great conversation, great ideas, and I'm looking forward for us to talk and get things going. And I'm keeping hope alive that by next week, Wednesday, we'll be able to hear from people. We'll be able to, especially the food. I know PPEs, we will get some PPEs, but I'm very concerned about the food. I really want us to get some stuff to give to the people, so people can have a good Thanksgiving. I would like to get some vegetables and some fruits and stuff that people can go home to cook, some rice and potatoes and whatever, that people can go home and have a good Thanksgiving. So thanks again for your help. Thanks for your contribution. And looking forward to seeing you December 3rd. On December 3rd, but before then, we will be seeing at the board office or wherever that we will be doing the distribution. So till then, if you need my number is 917-763-9284, 917-763-9284. And when you call, you don't ask for Miss Leopold, please ask for Fran. We are friends now and we are family. Just ask for Fran. Okay. So, and so if anything, any arrangement you need to do or anything, contact me or anything with the food. But if you need to ask me a question or anything, and you want to call me, feel free to call me. It doesn't matter. Okay. If you don't get me, send me a text message. I'm very bad when it comes to answering voice messages. So if I don't answer the call, just send me a text and I will respond. Sometimes I'm in a meeting or I'm conducting a workshop and I cannot pick up the phone. So I'll see the text and I will respond. Thank you so much. Have a good night, everyone. Mr. Burke, you want to say anything before we leave?
No, I just want to, I'm just very, very encouraged by the attendance at this meeting. I certainly welcome all the other health organizations. We're living in Central Brooklyn, which is the biggest user of health benefits as well as addiction, mental health. So I think if we all work together, we need to solve this. So while I'm hesitant about the future, I just hope as a team we can meet this. Thank you.
Yes, we can. Definitely we can. So I thank you guys. Have a wonderful night. Enjoy the rest of the week, which is one day. And tomorrow, if you eat ice cream, go into the weekend eating ice cream. If you drink Baileys like me, go into the weekend, have a nice shot of Baileys. Whatever makes your heart happy. And you see, Kim is giving me the thumbs up. Bailey, are you looking at the Bailey's, Kim, or the ice cream? The Bailey's, right? Yep. I think Kim is getting the bottle for us right now. You see? Oh, that's not Bailey's cream.
Oh, wow.
Yeah, but whatever that you do, stay safe, be safe, and remember, the things that you cannot change, don't attempt to change it. Just make a way and walk the path that will make you happy. Trying to stress over the things that you cannot change, it makes no sense. So just live the life that God has given us, and every day is a blessing that He has given us. And let God take care of His business. Have a wonderful night, family, and we shall see in 2 weeks. Stay safe.
Okay.
You too.
Ciao.
Thank
Good night.
you.
Bye. Good night.
Thank you, Francesca, for a great meeting.
Yes.
You're welcome.
Oh,
Have
I
a good
also
night.
want to acknowledge Melissa, who did the best meeting minutes that I've seen in years. So thank you, Melissa.
Oh, yes, she did.
Thank you, Warren.
Yes,
Thank
you did. Yes, you did, Melissa. Thank you so much. Thank you.